Hi everyone, Dr. Jacobs here. We are going to talk about collaborative care for serious mental illness and, why does it matter? So collaborative care is an evidence-based approach to managing mental health conditions that's implemented across oftentimes a clinic or provider organization. This model systematically screens for and follows patients. It tracks their level of symptomology and it changes treatment until a remission is achieved in the best case scenario when it's done well or effectively. The collaborative care model was originally developed and tested to manage common mental health disorders in primary care settings. However, it's increasingly being applied to more complex conditions, including serious mental illness, and it's being used across a wide range of private and public sector settings. Since 2017, new billing codes have made it possible to bill for collaborative care services through Medicare and many private insurers. And the American Psychiatric Association has a number of resources that can help clinics and organizations implement collaborative care programs as well. There's also a lot of information from the University of Washington about advancing integrated mental health solutions. They have a great resource center about this. So just some more information in general about collaborative care. It is especially helpful with the treatment of depression, anxiety, and PTSD. There's a growing need for the treatment of substance use disorders with mental health, as we know. And so the core principles of collaborative care suggest that this model would lend itself to effectively working with patients in multiple ways. So that's really great. And it makes sense to leverage this model's resources and workflow to include multiple different providers together. The promise of a collaborative care model is a powerful one if it's done correctly. And that's really the key piece, right? Like it has to be done correctly. So the model, if done correctly, would look at these pieces. So the first one would include a patient-centered team. So providers working collaboratively to share their care plans and to incorporate the patient's goals, not just goals that we would create for the patient, because remember, the patient is the expert of their own experience. The ability to get lots of different care at a location is comfortable to patients and it reduces duplicate assessments. Increased patient engagement oftentimes results in better healthcare experience and improved patient outcomes. So what's really great with collaborative care is hopefully you're seeing the patients like primary care, mental health care, other care providers working together effectively. So the idea of population-based care is that the care team would share a defined group model and tracks it so that nothing falls through the crack. The care team is tracking and reaching out to patients that are not improving, and making sure that there is an outreach effort for those patients. So the next part, the measurement-based treatment to target. Each patient's treatment plan clearly articulates goals and clinical outcomes, and these are routinely measured by evidence-based tools. Treatments are actively changed if the patient is not showing improvement until the goals are achieved. So it's not like a one model fits all. You're able to try different ones. And on top of that, you have a team of people working together with different expertise and different knowledge. So the team base is really effective because different people can suggest different things. The next part is evidence-based care. Patients are offered treatment with credible research to support their efficacy in treating, what they're there for. Treatments are actively changed. And the collaborative care model has a substantial evidence base for its effectiveness. And then, of course, accountability care. All the providers within the team are accountable to each other, and then, of course, accountable to the client himself or herself or themselves. So some of the other pieces which we just talked about are making sure that the patient is at the center of the care, that individuals are getting outreach care. So if they're not attending or they're not making appointments, just kind of following up to see what's happening. Evidence-based care is happening, and that providers are accountable. So you're not a provider who's just scheduled to see 100 different clients because you're trying to get those billing outcomes. You know, you're really there for quality of care. Your clients matter, and you're working to make sure that they're getting the best care possible. You know, another major aspect of good collaborative care is that there's a patient-centered team. If you're working with psychiatry and you're working with billing and you're working with behavioral health or mental health, ultimately within the center of that triangle is the client. So all of the focus at the end of the day is ensuring that the client is getting the best care possible from all aspects of the team. And that is the collaborative care model. Thank you.